All right. Well, it's the night before potentially my last treatment for my shoulder and my hip. About to drive down to Austin, stay at a friend's house, wake up at the ungodly early hour of like probably 6:30 or something, and then get to Dr. Fullerton's office at 7:30. Um, I'm excited, more excited I think than I have been before, and I'm also more scared. I don't know, just the fact that maybe this isn't, the last piece of the puzzle like every other time. Um, I just feel like there's so little left to address, at least with my shoulder, that I'm pretty confident that this actually will be my last treatment, at least for the shoulder and neck area. I'm worried that Dr. Fullerton will miss something with my hip, just because the pain is so diffuse. Like, I feel pain in front of my hip as well as my lower back. That my TFL has been super tight, and it just makes me worry that he'll miss something because there are so many different things that are wrong still with the hip. But the thing that gives me hope is that when I left the office last time, I was in a lot of pain everywhere, or everywhere in my hip that sometimes hurts, it all hurt. And that was just from him poking around on my lower back in the QL area. So it is possible. If they do resolve these two, my shoulder and my hip, then I will be an amazingly happy man. There is a couple issues with my ankles that I might get addressed, but that's just a cherry on the top. I'm excited. I'm pumped. I'm amped. I'm not looking forward to waking up so early. I normally wake up at around 8, so this will be shifting everything 2 hours back, and I have to stay here in Dallas to do something with my wife, and she's not home until, she won't be home until 7, so yeah, that's making me leave late, so I get there late, I have to wake up early. It's going to be fun. A lot of caffeine tomorrow. So I will try to record as much as I can of the procedure. Might not be able to because I'm all by myself. I'll try asking one of the assistants. Last time there was 3 of them just sitting there waiting, watching me, which is a little weird. But we'll see what happens. All right, this is Adam, signing off. Is there anything in those vials that like
in here or
yeah,
in here?
in
these, no. They're just sterile tubes. But in the syringes that I do the blood in, we have anticoagulant.
That's what I figured.
Yeah, it just keeps it from clotting in the tube.
I imagine that would be difficult dealing with clotted blood.
Yeah, and it's hard to get platelets out.
Yeah.
Yeah, we just put them in here because they fit in the centrifuge. So.
Right. Pretty fancy thing to keep the sterility of the environment.
Yeah, right? It's very cool. Yeah, we've actually, Dr. Fullerton is doing like workshops to train other doctors on his approach to prolo and anatomy, and I was surprised by how like revolutionary they thought this system was. They were like, oh my gosh, we're all using PRP kits, like where you put the blood into a machine and then it spits out like the rich plasma.
Yeah.
Or it's like it's the concentrations.
All right. Well, they have drawn my blood and then they're spitting it out because of the assessment that I had 2 weeks ago. They didn't really need to. The tech and assistant didn't really need to ask me what the issues are, stuff like that. So now I just have 30 minutes all into myself. Well, I guess Dr. Fullerton looks over my charts and stuff. That's what I'm guessing. Didn't get to wake up early enough for Taco Deli. So I'm a little sad about that. But maybe I'll be able to leave this place soon enough. It's about 8:15, so hope I can leave, before noon. I'm scheduled for 2 hours. These things tend to take their time. So anything else eventful happens, I'll report in. And this is the rotator cuff, right?
No, this is Teres major.
Oh. That's not a rotator cuff muscle?
Nope.
Just the teres minor?
Teres minor, which is...
I thought they were both part of it.
Teres minor is much smaller, amazingly.
Is that why it's called
It's
minor?
in here.
I was about to say, there seems to be a gray blob that diffuse...
It's forming the tendon there. Relabel that. So here's part of the infraspinatus tendon.
Is there anything you need me to do to make this easier?
Yeah.
He's losing the gel on the...
You gelling?
I'm gelling. You gelling?
Like Magellan.
That's chilling like Magellan. Advertising works.
Yes, it does.
So it's hard to standardize these,
That's why you look at the other side. Just to compare.
Right.
That's
and I
the
just
control.
look at a lot of them.
Yeah,
Patient
experience.
to patient to start getting a feel,
Mm-hmm.
That would be the infraspinatus muscle, the more inferior and proximal MTJ, hypoechoic core fiber definition.
The how's the teres minor looking? Or have we gotten there
It's a
yet?
little fuzzy too.
Alright.
It's close to this spot.
Yeah.
So that one's even harder to stay on when doing a panoramic.
I didn't know if me rotating like that would help be more visible. I had to dig in there.
Yeah.
It's also weird when I'm swallowing, my left ear is decompressing a lot
Oh, right now?
more easily. Yeah. There's a needle.
Yeah, you even got there with the two. Very nice.
That was weird.
Yeah, what'd that feel like?
I don't know. I could tell that you were reaching
Yes.
with the needle.
Yep.
All right, well, we're done. It's 11:11. If I had to make a wish, it would be that this is the last time that I had to see Dr. Fullerton for my hip and shoulder. Definitely feel worked over. He found some stuff in my delts, which when he addressed, my delts were real twitchy when they responded, so that seemed to be important. I convinced him to try to address the Omohyoid. He wasn't really sure, and I was like, come on, I'm here. I don't want to have to come back, so he did that. My jaw, I can't really move my arm higher than this. This is fine, using the bicep, and then after that, it's, no good. So it's going to be fun driving back to Dallas, basically with one arm. Pain-wise, I feel fine. Just hurts to do certain things, and as long as I don't do them, I'm okay. Really hope my hope I'm done with my hip with my back Tried to come up with anything and everything that hurts, and when he nerve blocked it didn't hurt. So the one thing that I'm worried about is that if this will, now that these muscles are going to start working, maybe other muscles need to now keep up and they're damaged, so they start hurting. That's been the issue for like the past 3 or 4 treatments. So we will see. But I really hope I'm done. I could have been okay without even getting this treatment. I mean, I'm in pain, but it's all relative, I guess. And at some point in time, you need to, I feel like, just accept that, this is life. This is getting older. Aches and pains. Soon, hopefully, gonna have a family and stuff. But I guess for now, I'm just able to be selfish and try to not be in pain. Sad that has to be something to be selfish about, but whatever. Feel good. Probably gonna get dry needled sometime next week. That's a modality that Dr. Fullerton said I could do. He wanted me to wait about a month for cupping or for massage, because apparently that can break up, stress the healing tissue. So not gonna do that. 2 weeks of doing nothing, not bed rest, but just not, the physical activity, and then another 2 weeks of doing resistance training, but like 10% of what I'm starting off with, so basically nothing, and then working from there. Gonna have a physical therapist that does the dry needling. I'm also gonna have him do some rehab exercises, I guess, for the teres minor, teres major, posterior deltoid, medial deltoid, and the QL. So those are the muscles that I know of that were addressed, and the Omohyoid, but I don't think there's any Omohyoid physical therapy exercises. So I'll report in